In the last few days, different reports have been circulated on social media of an Ebola patient who had died after being admitted for treatment at Mubende hospital. However, Sarah Opendi, the State Minister of Health for General Duties, has dismissed the claims of any cases of Ebola in the country. During a Sunday morning press briefing, Opendi clarified that the Mubende patient, identified as Emmanuel Sabit, had been diagnosed with Crimean Congo Hemorrhagic fever.
I want to allay the fears and anxiety of the public that we do not have any Ebola outbreak in the country. However, what we have is the Crimean Congo Hemorrhagic fever. And of course, we should note that this is not a new outbreak. We've had these cases right from 2013, 2017, and 2018.
The minister also warned the public to be vigilant since Crimean Congo fever can easily be transmitted through contact with domestic animals.
Human transmission may occur when human beings get into contact with infected ticks or direct contact with blood or tissues of an infected animal.
Opendi said government had also stepped up the screening of people entering the country through different border points, looking out for people who could be entering the country with the deadly disease.
We have instructed leaders in the districts of Kampala, Wakiso, Kisoro, Kanungu, and all the other districts bordering DRC to reactivate the district task forces which are in place now and preparations for any possible outbreak. Because as you are aware, we have porous borders and a lot of movement of our people to DRC and also people moving from DRC back into Uganda.
Health Ministry officials are also monitoring some of the relatives of the deceased Mubende patient to see if there were any who had contracted the Crimean Congo fever.
The attendants of the deceased, who included his expectant wife and 4 others, were immediately quarantined and they are closely being monitored.
Some of the symptoms of the Crimean Congo fever include headache, high fever, back pain, joint pain, stomach pain, vomiting, red eyes and flushed face, among others. The threat of Ebola comes at a time when neighboring Democratic Republic of Congo is grappling with an outbreak of Ebola. The Ministry of Health is paying special attention to people entering the country from DRC, especially since they are expecting an influx of pilgrims coming for Mother's Day celebrations. Juma Kiria, NTV.